Hello everyone. Our fourth video in this series of prescription writing is again about some anticoagulants. As we discussed earlier, dose of anticoagulants is going to be different for your indication, right? If it is um, DVT, if it is PE, if it is stroke, all these things are going to have different dose of anticoagulants. Apixaban and rivaroxaban are the most commonly used anticoagulants. You have to open BNF and look at the right kind of dosage. Let's read the task. You are FY2 in medicine. Miss Hannah Knowles, age 60, has been admitted to the hospital because of breathlessness. She was diagnosed with pulmonary embolism and was managed in the hospital. She is a diagnosed case of hypercholesterolemia, and she had a long haul flight 10 days ago. Her EGFR is 87, D dimer 4000, CTPA hypoperfusion. She was prescribed the following: apixaban for 6 months. Her regular meds are statin, aspirin, and patient is allergic to codeine. She gets itching after taking it. Write down the prescription for above medication and check dose and write down the apixaban. As we discussed earlier, we are going to look at the dose of apixaban. Other things that are very important in this patient is EGFR is 87, that is normal. Allergic to codeine, you don't have to prescribe it. Apixaban 1, statin 2, and aspirin 3. These are the three medications you have to prescribe, right? So let's first look up for dose of apixaban in BNF. So BNF says if you are doing treatment dose, then it is 10 milligram BD for 7 days and 5 milligram BD for 3 months at least. And if it is prophylactic, 2.5 milligram BD. And if it is prophylaxis of DVT, then it is this. If it is prophylaxis of stroke or systemic embolism in non-valvular AFib, stroke, TIA, heart failure, these kind of things, then it is going to be 5 milligram BD. And right now we are treating it. In treatment, we are going to give loading dose for 7 days, more dose for 7 days. And after that, after 1 week, we are going to wean it down to 5. And one more thing is that patient is already on aspirin. So if somebody is on aspirin, clopidogrel, and you are going to start them on the blood thinner, then it is important that you stop aspirin for the time being because it will increase the risk of bleeding. Okay? You can't give two different kinds of blood thinners together. So you have to write it down, and there is another task as well. These two are similar tasks, so we are going to discuss both of them together. You are FY2 in general medicine. 55 years old, Mr. John Holmes was admitted with left leg pain and swelling and diagnosed with DVT. He went to South Africa last week and returned just 2 days back. Please prescribe rivaroxaban for him. His regular meds are amlodipine, aspirin, and paracetamol. EGFR is not given, but this is a man who was just recently diagnosed with DVT. Rivaroxaban is given. We have to prescribe rivaroxaban because it's in the task. Amlodipine is antihypertensive. You will prescribe it. You will skip aspirin because patient is going to be on blood thinner. And then paracetamol you can prescribe. Dose for rivaroxaban is going to be 15 milligram BD taken for 21 days, followed by maintenance dose of 20 milligram OD for 3 to 6 months. So let's see how we are going to write anticoagulants. Again, apixaban 10 milligram BD for 7 days, 5 milligram BD for 3 months at least. So open your blood thinner page, anticoagulant page, and then write it down like this. Apixaban in capitals, 10 milligrams. Start date would be 7, stop date will be 13, and after that you have to cross this portion. Okay, so there is no mistake, there is no doubling of the dose because you are changing the dose. So when you are changing the dose, so you don't have to change You don't have to cut this portion. You have to write down again anything that is, you have made any mistake in the dosing or anything like that, or if you want to increase it. For example, there is another drug where you are increasing it from BD to TDS. Always write it as a new one. Don't amend the already present one. So then I have written a Pixaban 5 milligram. Start date would be this one, 14, and I cross the initial portion so that nobody is giving this 5 milligram in the initial days. In the additional information, I have written as loading dose PE and then maintenance dose for 3 months because duration is mentioned in the task. That is the first task that we did. And then this task in which we have to prescribe rivaroxaban for DVT. So it's 15 milligram BD for 21 days, followed by maintenance dose 20 milligram OD for 3 to 6 months. So that's how you are going to write rivaroxaban. As it says, 21 days initial dose. And here you can see that this chart is only for 2 weeks. So write it down, rivaroxaban 15 milligram per oral BD. 7:10 is the start date, and stop date you have to add, which will be after 3 weeks. I will be, I have written loading dose for 21 days here, and after that, patient should be on maintenance dose. So you can't write next 7 days of 15 milligram here because you have already written date on the top of the page. So if you want to write another dose for next 7 days, for the patient, you can write down on a new drug chart, not on the same one, right? Because there is only one page where you can write anticoagulant, and if in one drug chart it's finished, you are going to write and any other drug. You have finished one drug chart, and even after that, for sometimes patients are staying for longer time. They are staying for months in the hospital. So once one drug chart is finished, you are already always going to add that in the new drug chart. You are not going to write down on the same drug chart here. For example, here, this is a big mistake. Even if only you have to write only one drug in the new drug chart because you can't, because this is a wrong prescription. So don't write it here. It's okay if you are only writing on one paper because patient might not be able to stay in the hospital. Patient can go home once he is okay, even within this 2 week time. So after that, you can write down on the discharge letter about this maintenance dose, loading dose, and everything. So for your exam purpose, if you can write down for 2 weeks, stop date you can calculate from 7. So 20 is here. So on 27th will be your stop date. So after that, you can, just switch to the maintenance dose. So I hope you got my point, but if you didn't, then you can write down in the comment section and I will be happy to clarify that. So that's it. You have to write down blood thinners like this. This was the section of blood thinner, and we have completed all of these. Just one is left, which is about VTE prophylaxis. In my next video, I'm going to talk about that, and then we will be doing some other prescriptions.